Be really great information. We're happy to collaborate with you guys. All right. If you guys do have any questions, absolutely write those down, throw them in the comment section. I will open everyone's mics up for questions and comments at the very end if you guys do have any. I am definitely open to answering any questions that you guys have, but throughout the PowerPoint, I'm just going to kind of go, so just write those down and we can answer them at the end. So today we are going to be learning about an introduction to applied behavior analysis, also known as ABA. A little bit about me, since you guys aren't familiar with me. My name is Angie Robbins. I am a board certified behavior
From who?
analyst.
Who won?
I'm going to go ahead and make sure that everyone's mics are muted. There we go. Okay. I have a bachelor's degree in elementary and special education from Indiana University, and I have a master's degree in applied behavior analysis with an emphasis in autism, and that's from Ball State University. I've been a BCBA for a little over 3 years now, and I've worked at Cornerstone for over 5 years. I have worked with so many different children and adolescents with all different types of abilities. A little bit more about my role here at Cornerstone is I collaborate a lot with our other BCBAs, our clinical directors, and other professionals to provide the best treatment possible for our kids and our families. I ensure a lot of our therapy from our staff members and make sure that all interventions are ethical and best practices are being used. And then I additionally do a lot of parent training and community trainings. So this is a regular thing for me, and we're really excited to be able to spread a little bit more information about ABA to all of you guys. So today ABA has a lot of information in it, so I tried to break it up as much as I could. So we're going to start with a little bit about ABA and the evidence-based practice that we use. Then also dive into some communication and motivation, understanding behavior, the ABCs of applied behavior analysis, reinforcement and punishment, some functions of behaviors, and replacement behaviors. Those are really, really crucial. And then we'll talk a little bit about the importance of assessment and generalization. So, ABA is a research-based science where the environment is changed to change the behavior. This is really important in an ABA. ABA can sometimes get a bad rep, or some people have some negative connotations to it, but really it is just changing the environment to help the child understand different situations and how to use their communication a little bit more. ABA focuses on behavior specifically, and that has to be measurable and observable. It's a movement of a person or an action, so it's not thinking of things or emotions and things like that. It's definitely something observable and measurable. The environment surrounding behavior, both good and bad, is changed in order to increase appropriate behavior. So those behaviors we want to see, and then decrease some of those more challenging behaviors, maybe things like tantruming or physical aggression, running away, things like that. ABA is all about increasing more appropriate behaviors and really working with the client and working with the family to increase skills that the child needs in their daily life. These goals are very crucial for them, but we want to include and make sure that it works for the family as well. We want everything that we do here at either a center, or if you're receiving ABA services at home, we want it to translate into the community and into other places, not just here at our school or at our center. We definitely take a lot of data, and treatment is applied to, again, decrease that problem behavior and increase more appropriate behavior. Another really important factor about ABA is that it is an evidence-based practice. So this is a practice based on scientific evidence. This isn't something that someone just thought of and just kind of threw in and let's see how it does. There's a lot of evidence-based practices, articles, research done on ABA to ensure that it is successful. You have to be kind of tricky nowadays because we have a lot of social media posts and different things on the internet and blogs where people can say a lot of different things. And what may have worked for one person does not necessarily mean it's going to work for someone else. And parents have to be really, really careful with that. Sometimes parents can feel like you're just needing help. You need some sort of help, and this blog said this and it looked so awesome, so I'm going to do that too. But is it really what's best for your child? Is it truly going to work because it's backed by science and has evidence? And it can be difficult, but luckily ABA is. So that's something that we really try to push for. If you're interested in different therapies and different things like that, really try to look into your research by using Google Scholar rather than Google. That way you know that it's backed by evidence, it's been peer reviewed. You just kind of always want to be mindful of blogs and information coming from someone who may not have a credential or social media especially. And then I always recommend speaking with your doctor or your other professionals, medical professionals, about interests or concerns. ABA is really great for a lot of children, especially children with autism, but that's something that your doctor can also speak more about if you're interested and think that might be appropriate. We also do, for example, here at Cornerstone, we do assessments and have an intake coordinator as well, but I always recommend speaking with your doctor. One of the biggest things about ABA that's important is our push for communication. Communication is so key for our families and our children. A lot of times our kids may be engaging in some sort of behavior that may not be the best or something that we're not wanting. And a lot of times it's due to a lack of communication. That child may not know how to ask for something or how to say what they need or say something that's bothering them. So we really push a lot of communication, and that comes in a variety of different ways. That might be vocal, like how I'm speaking right now. It may be used with ASL. A lot of our families and our children use sign language. We even have a few clients at our center who are deaf. So ASL is a really, really great option, and is often a really great entryway into increasing some of those vocalizations. Some of our children also may use an augmentative alternative communication device, also known as an AAC. So it's kind of like an iPad, and it has pictures or words on it, and they can push the button and the speaker will say what they're saying. So it's a way for them to have a voice through technology. Sometimes they're also called speech-generated devices. They're a little bit different, but along the same lines, some sort of technology used to help vocalize that communication. And then something called PECS is also something that is widely used in ABA practices, and that's a picture exchange communication system. A lot of these are going to come from a speech and language pathologist. So I always recommend reaching out to an SLP or seeing if your school or the center that you're at has some services for speech. That can be incredibly helpful for families. And with ABA in general, we like to collaborate with a lot of other professionals. It's definitely not a one-size-fits-all, oh, this is going to work when we're done. We definitely have to collaborate with a variety of different professionals, and SLPs, speech language pathologists, are the perfect person to collaborate with. Something else that's really crucial for ABA is we use the child's motivation. This is something that's kind of a hot topic for discussion in the world of ABA. Some people who may not be as familiar with it just think that, oh, we're forcing the kids to do this all the time, and then sometimes we give them what they want. That's not the case. We always are finding what that child's interested for first, and then we are working on some programming and providing them with that reinforcement. Having that motivation can make learning so fun, makes it really natural, and can kind of break through those barriers to help them learn new things. A little bit more about motivation. Like I said, ABA-based therapy always follows the client's motivation. We incorporate their interests into our programming and therapy every day, and this allows the clients to be interested in the activities that are at hand. We want them to be interested in what they're doing and how they're doing it and everything. We want the child to lead us. We want to have that child know that their voice is important and give them that ability to say, I want to do this, and then us go and do it. That's awesome. Sometimes it can be a little bit difficult at first. So oftentimes in ABA, you'll hear a therapist giving the child lots of options. We could go outside, you could jump on a trampoline, you can go read books. What do you want to do? And listing out those options, or even bringing them out to the child and showing them and seeing which one they might seem interested in, is a really great way to start increasing that communication. We'll often use first then type statements. So, okay, first you need to go wash your hands, then we can go play outside. So letting them know, first we got to do this thing first, and then you still get to do what you want to do. We here at Cornerstone, we use backpacks, and so we put tons of the kids' toys in the backpacks. So no matter where they're at, the therapist has something that is preferred with that child. We always want to make sure that we have something that they're interested in. So motivation is key to ABA. We always want to follow the child's motivation. This is very different from bribing or dangling the carrot, as some people will say. ABA is not bribing children to do things. It is not using threats or forced choices. It is always finding that motivation and incorporating it into programming. That's a common misconception, and I always just let people know we're not bribing children. It's really teaching them how to do things more appropriate with the things that they're motivated for. All right, so next we're going to talk a little bit more about behavior. So I mentioned that behavior alone is observable and measurable, and it also has to be of a living thing. So observable means that two people can agree that this happened. So you and I can agree that I'm holding a pen right now. That's something that's observable. Something also has to be measurable. This means that it can be measured. This is something that can maybe be quantified or counted. So how many times do I tap the pen on the table? 1, 2, 3, 4. We can measure it. We can see that it's happening and we can measure it. And then it also has to be from a living thing. So a common saying in the world of ABA is if a dead man can do it, it's not a behavior. So it has to be some sort of living action, thing, behavior that the person does. So for example, yelling no and throwing a car on the floor. That can be measured. We can say how many times they threw the car. It can be observed. We can see the car maybe go into the hallway or go into the next room. And a living person, a child, threw the car. Whereas something like being upset is not a behavior. That can't be measured. My upset is different from someone else's upset. Sometimes I'll hear people say like, oh, they're just mad. Well, I don't know what mad means. Mad to me could mean one thing, and mad to somebody else could mean something completely different. So in ABA, we really focus on specific behaviors. So I have some examples and non-examples for you guys. So sometimes I'll hear families say, oh, they just won't do it. They're not sitting up, they're not doing that. But that's not something that's measurable, not sitting up. So instead, we want to kind of explain that behavior. Oh, they're laying their head down on the table, or they're not answering a question. We want to rephrase that into saying they're shaking their head and saying no. always putting things into a measurable behavior is gonna help us identify how we can fix that behavior, how we can make it better or more appropriate. Another common thing that I hear a lot of families say is, are they being good or are they being bad? Well, what does good mean? What does bad mean? Again, that can be different for my expectations versus your expectations or someone else's expectations. So really quantifying and putting those things into a behavior analytic phrase is really helpful. So maybe being good would really mean, did they complete their worksheet, yes or no? Or are they falling on the floor while walking in the hallway? Or something like that, something that is observable and measurable. This is really important because there is always a reason for behavior. This is something that in the environment causes our behaviors. We abbreviate this into the ABCs. So first we have the antecedent, and this is what happens first. This is what happens before. Then we have B, behavior. What did that behavior look like? Did the child hit? Did they run away? Were they crying? Things like that. Then we have the consequence, and this is what immediately happens after the behavior. In the world of ABA, you're going to hear a lot of words like consequence, punishment, bad, good, things like that. They don't mean typically what most people think they mean. And we're going to talk a little bit about that later, but I just wanted to kind of outline that real quick. The ABCs, when you see that word consequence, it does not mean bad, okay? It just means what's after the behavior. So let's dive a little bit more into those. So A is for antecedent. So for the first scenario, Tommy, a 4-year-old boy with autism, is throwing everything and anything he can get his hands on around him. He is also screaming and crying at the top of his lungs. Before we can figure out the reason or the function of why Tommy is doing this behavior, we have to look at what happened first. This is going to tell us why that behavior is happening. So first, Tommy's mother explains that Tommy had been watching the same clip on his iPad over and over again. She told him it was time to be all done and took the iPad away from Tommy. There's your antecedent. That's what happened first. She removed the iPad, then he started throwing things and having a tantrum. This is really important to understand in order to turn that difficult behavior or challenging behavior into something more appropriate. So again, this is really critical for all the factors playing in how to decrease those negative behaviors. Once we understand what happened immediately before the behavior, we can figure out why this is happening. You may hear this called a trigger, or what may cause the child to become upset or may cause the child to do a certain action or movement or behavior. Sometimes you'll hear this called a behavioral trigger, what triggers them. Once we can understand that child's trigger, then we can create some preventative strategies, a different way to approach it so that that behavior doesn't happen. And we can also create a replacement so that they know that they can do this instead of throwing items and tantruming on the floor. So that leads us to our B. B is for behavior. For the example that we shared about Tommy with his antecedent of getting that iPad taken away, now it's our job to look at this behavior and figure out what is it and what specific actions is Tommy engaging in. So for that example, there's 2 main behaviors, property destruction and tantrum. So again, behavior is always something observable and measurable and done by a living being. So for property destruction, he is throwing items. He is chucking them out. He's mad, he's upset, but those aren't necessarily behaviors, but we can see that he is engaging in property destruction. Maybe you could count how many times he threw something or how far he's throwing it. Tantrum, maybe it's screaming that can be heard in another room. Maybe it's with or without tears. Sometimes, oftentimes, flailing arms and legs, maybe rolling on the ground. I'm sure we've all seen a tantrum and are very familiar with that. But that's our behavior. We want to look at what's happening and kind of dig at all of those specifics of what that behavior really is, because sometimes there's more than one behavior happening at the same time. Before we kind of lead into consequence for our C, I just want to say that, again, consequence does not mean punishment. Oftentimes in the outside world, we'll hear, oh, their consequence is this, and they have to go on a timeout or something like that. That is not the word definition for consequence in ABA. All consequence means is that it's just what happens immediately after the behavior. And there are two main forms of consequence in ABA: reinforcement and punishment. A little caveat on punishment: this does not mean bad, and this also does not mean timeout. Punishment just means a decrease in behavior. I'm going to say this a lot because it's a really important term to kind of understand when you're learning about ABA, is really remembering that consequence just means what happens after the behavior, and that punishment just means a decrease in behavior, as reinforcement means an increase in behavior. And we'll talk a little bit more about that as well. So again, C is for consequence, and this is our last step of our ABCs. And this is what happens immediately after the behavior. So we want to look at the end result of the situation and then think about what steps can we take to help the child with this in the future. And so there's two examples that I want to go over on possibilities of consequence for Tommy and his mom. So the first example of the potential consequence would be that Tommy's mom becomes frustrated with the constant screaming and crying and throwing of things, so she just gives him the iPad back. So let's look at our ABCs from this situation. So we have our antecedent: the mom removes the iPad. We have the behavior: throwing items, property destruction, and tantrum. And now we have the consequence: is he gets the iPad back. This is really important. You can see what happens first, what the behavior is, and then what immediately happens afterwards. The reason or the function of this is he wants the iPad. He wants access to that tangible item. Because Tommy's mom gave him the iPad after throwing a tantrum and learning that, hey, if I throw things and I cry, I get what I want. So what happened is, accidentally, his mom has reinforced his tantrum and his property destruction. She didn't mean to, but by giving him that iPad, by giving him what he wanted after tantrum and property destruction, he is learning, oh, when I engage in these maladaptive behaviors, I get what I want. And so this behavior is going to increase in the future. It was accidentally reinforced. So let's look at our consequence possibility number 2. Tommy's mom waits for Tommy to calm down and then says in a calm and neutral tone, "Tommy, I like how you've calmed down. I understand and see that you're upset." She then proceeds to help Tommy make a different choice by providing him with different options. Once Tommy has successfully made a different choice, she praises him with hugs and tickles, which he absolutely loves. So, antecedent: mom removes the iPad, same. Behavior: same, property destruction and tantrum. However, this consequence, she is ignoring him until he is displaying more appropriate behavior. She provides him with choices. He makes a different choice of an item to play with, and she reinforces that. Yay, good job, gives him hugs and tickles, all of those things. Same function, he still wanted access to some sort of tangible item, and we provided that for him. So once he has calmed, She acknowledges her son's situation. I think this is really important. We're all human. We all have a lot of feelings. It's okay to get upset. It's okay to cry sometimes. It's okay to show that emotion. So I think it's really important that we share with our children and acknowledge that I can see that you're upset. I understand why you're frustrated or sad. I think that's really important for autonomy and just overall independence. But then we want to provide them with a replacement behavior, something that they can do instead. Picking another item, maybe asking, hey mom, I want more time on the iPad. Okay, hey, that was better asking me. Yes, let's do that. Prompting that communication can really meet the same function and decrease those maladaptive behaviors. Again, communication is such an important part of ABA therapy, and we want to reinforce that appropriate communication, that appropriate behavior. So once Tommy has used his words, or maybe pointed, maybe he's not a vocal child and he's using pointing to identify what he's wanting, then she can praise him, give him hugs, tickles, all of those things. And he's learning that, oh, when I point or when I say what I want, I get what I want. And that's where that replacement behavior comes, is really important. So let's talk a little bit about reinforcement. I've used this word a little bit now, but it really just means an increase in behavior. So it happens more often. That might mean adding something, you know, say you're at the grocery store and you say, okay, you know, what do you want? I want some cookies. Okay, first let's walk all around the store. Don't touch anything, hands in pockets. You do that, then you can get your cookies. Once your child has done that, you add and give them something that they're enjoying, and it increases, ooh, when I keep my hands in pockets, I get what I want. I get my cookies. Oh, I'm going to do that again. So it's increasing that behavior in the future. Another example for negative does not mean bad. Negative just means removal or taking away. So think of when you hear positive or negative, think of math. Positive plus, you're adding something, whereas negative is a minus, you're removing it, you're taking it away. So for example, if you had a sunburn and you put aloe vera on your sunburn, it is going to relieve that pain. It's taking that pain away. It's taking away maybe the tightness that your skin is having or anything like that. You realize like, oh, that worked. I'm going to do it again. That's a reinforcement. You are increasing the likelihood of that to happen again. Our method of approach is to give attention and reward our children when they are doing appropriate things. But when they're engaging in those not so appropriate things, we oftentimes want to completely ignore it. Now, I understand that's difficult for families. If you have a screaming child, especially if you're in the grocery store in a public place, and it's hard to just ignore your child as they're screaming and crying over and over and over again. But the more we ignore it, and then once they're calm, show them what they can be doing more appropriately, then reinforce that, that's where your child is going to learn about more appropriate behaviors on what to do. Sometimes we give attention to maladaptive behaviors and we accidentally reinforce it. So if your child knocks a drink off the table and you say, hey, don't do that, and your child realizes, oh, when I knock a drink off the table, I get my mom's attention. Oops. We accidentally reinforced it. So now they might knock drinks off the table more because they know that's how they get mom to come over here, and mom's got to clean it up and all those things. So we want to teach them, hey, you could just come over here and tap me on the shoulder or say, hey, mom, come play with me, or whatever that case may be. But we want to be really, really careful on giving attention to maladaptive behaviors. Punishment, again, punishment does not mean bad or time out or removal of toys or loss of privileges. This is not punishment. In ABA, punishment is just a consequence that decreases behavior. So this behavior is going to happen less in the future. Okay, so it's really important to remember that punishers such as yelling or timeouts could actually be reinforcing a child or making it happen more. So for example, if a child pushes dad and dad yells, "Stop that," the child just gained the attention they wanted because they think it's funny when dad yells. So they're probably going to do it again. Another example, this is a really common one. A child acts out in class, and so the teacher says, "Go sit out in the hallway, you're in timeout." The child didn't want to complete the assignment or be in class anyways. So what the teacher thought was a punisher of having the child go in timeout was actually a reward for their behavior. They didn't want to be in class. They didn't want to do the assignment. So by them getting to leave the class and go sit outside in the hallway acts as a reinforcement, not a punishment. They realize, ooh, when I do that, I get to escape the entire worksheet. I don't have to do it. I get to go sit by myself, and they're rewarded. So it's really important to remember that punishment and reinforcement really just means if the behavior is going to increase or if the behavior is going to decrease in the future. Let's talk a little bit about why these behaviors happen. And this is known as what are the functions of behavior. So in applied behavior analysis, there are always 4 functions of behavior. So I can always outline why a behavior is happening with at least 4 different reasons. Access to attention, access to tangible, which is just items, toys probably, things, escape or avoidance, and then self-stimulation. You'll also hear this called automatic reinforcement. You may even hear it called sensory as well. There's a lot of different terms that are kind of used for that one. So for access to attention, I think this is a huge one for our kids. All kids pretty much love attention. So this is when someone's desires their focus to be on themselves. So an example may be a child yelling, look at me, mom, 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 mom. And the mom finally responds, what is it? The yelling acts as access to attention. The child is yelling over and over and over again to get the other person's attention. But we don't want our kids to always just be yelling constantly, so you don't want to give in and give them attention. You would want to wait until they're quiet, or maybe just said, hey mom, at a normal tone of voice. Then, hey, I love how you said mom just once, and at a normal voice, what's up? How can I help you? So really wanting that attention for something. Access to tangible. Again, tangible is just an item, maybe your phone, an iPad, a puzzle, book, drink, anything tangible. An example may be the sister takes the iPad away from the brother and the brother pinches the sister, so she gives the iPad right back. They wanted access to the iPad, that tangible thing. Because that pinching got them that iPad back, it's more likely that they're going to pinch again because they know that that got them what they wanted. It got them access to that tangible thing. This is a really common one, especially with kids, especially now that many kids have tablets and iPads or mom and dad's phone and things like that. Kids definitely love their technology, so this is a big one. Another big one is escape or avoidance. This is when something signals a situation that they don't want to do. They want to escape it, they want to run away, they want to avoid doing it, something they may not like. Maybe it's a loud noise or a task that they don't enjoy. Maybe you told them to go make their bed and they don't want to make their bed, or clean the dishes or things like that. An example may be a therapist says, wash your hands, and the learner runs out the bathroom and they're gone. They think that, oh, if I just run away, I don't have to do it. If that therapist does not ensure that the child washes their hands, that running will continue. They have learned, ooh, if I run away, I get to escape this. I don't have to do it. So we always want to bring that child back and follow through with that task that was at hand, so that they learn, hey, we can't just run away. We got to continue doing what we're doing, and then we can go. And then the last one is self-stimulation or automatic reinforcement. And this is just something that is within you that makes you feel good. So this one's a little bit more internal, but it's an action or a movement that feels good to you. So even right now, I'm kind of swaying in my chair. This is automatic reinforcement for me. Some people sit at the table and tap their foot or shake their foot a little bit. That's automatic reinforcement or self-stimulation. Maybe twirl their hair. Again, automatic. It's something that they can do themselves that feels good. If that gives them the sensory input that they're looking for, they'll continue to do that. If they don't like it, they're not going to continue doing it. A lot of kids may like different textures, rubbing their hands on the carpet and then on the table. It's an automatic reinforcement for them. It feels good, it feels cool, they enjoy it. Maybe it's soothing to them. They might like doing it, maybe it calms them down. So it's something a little bit more automatic within. So when we look at our ABCs and we look at our functions of behavior, we always want to give that child a replacement. So once we've determined that function, we want to teach them what they can do more appropriately. Hey, instead of throwing that item, you can just say that you're all done with it and you don't want to play anymore. That's fine, cool. We can pack it up and we don't have to play anymore. And then, hey, I love how you put your toys away. Awesome job. And reinforce that. We want them to increase doing the more appropriate behavior. Something that's really important is that the replacement behavior has to serve the same function as the inappropriate behavior. So if a child is interested in getting the iPad, they want the iPad back, you can't just say, oh, you can say you're all done and treat it as an escape. They don't want it. That's not matching. We want them to match. We want the function of the inappropriate behavior match the same function as the more appropriate behavior. So an example, maybe a child has learned that screaming during class gets them removed from the room. He is taught to request a break by holding up a break card where his teacher can see it. The screaming decreases because the break card has replaced the same function as the screaming. So they're learning that, oh, I can just hold this and I can take my break, rather than screaming out and then getting the break. Another example is a delicious cookie is denied to a child because it's almost dinner time. The child whines, but mommy, I really want a cookie. So the mom says, all right, fine, just take it, and gives them the cookie. Because the cookie was provided after the whining, that was the consequence, they gave the cookie, the child's more likely to whine in the future because they got it. They got what they wanted. In the past, it got them what they wanted, so they're going to keep doing it. Instead, a more appropriate replacement would be asking politely or waiting until after dinner time. And so you would really want to prompt the child, hey, we have 5 minutes until dinner time. Let's set a timer so you can see what that looks like. Or, you know, we have dinner, you can have half of the cookie now and then half of the cookie after dinner. Maybe it's a little bit of a compromise, and that's okay too. But we want to still teach the more appropriate behavior and replace it. That's really a foundation of ABA therapy, is teaching more appropriate behaviors. Some other examples here, the refrigerator came into view. So the child runs from the therapist to the fridge and grabs their juice. The function would be access to a tangible. They want a certain item. But running away and grabbing what you want is not good. So we want to replace that. So we bring the child back and prompt them to say, can I have my juice, please? Yeah, sure. Let's go get your juice. And then you give them the juice. They're learning that running is not appropriate, but asking is. A hallway's empty and friends are busy completing tasks. The child runs back and forth quickly many times in a row. This is automatic reinforcement. This is something that just felt good to them. It's an empty hallway. They had the opportunity. It feels good. They like going back and forth. We don't want our children just running away all the time. So we want to prompt them to ask for some sort of stimulation activity. Let's run. Perfect. Hey, I love how you told me right now this hallway is busy. Let's run over here where it's more appropriate or safer even. A therapist says, okay, buddy, we are heading to the cube. And the child runs away from the therapist. They don't want to go where the therapist is saying, so they're wanting to escape or avoid that task. Replacement behavior is to bring that child back and maybe offer them a break. Hey, it looks like you're not ready to go to the cube right now. Let's take a break here real quick, and then we can go to the cube. So allowing them to have an opportunity to say, it's okay to escape this for a little bit, but then we're gonna go there afterwards, okay? And then the last one is a therapist is socializing with another therapist. And so the child runs away from the therapist laughing and giggling and keeps looking back. This is access to attention. That therapist was busy and not giving attention to the child, so they engaged in something to get that person's attention. We would want to bring that child back and then prompt them to say, hey, come play with me, or hey, I'm over here, pay attention to me. Any of those would be appropriate. So ABA is really focused on making sure that we have some sort of replacement that we can give to that child. Some of the behaviors that ABA often looks at are tantrum, elopement, mouthing. There's so many. Physical aggression. Elopement means running away. It does not mean getting married, not in this context at least. But there's many different behaviors that in ABA-based therapy we may work on, whatever is appropriate for that one child. We typically like to create a description of that behavior so we know exactly what it looks like, leaving a designated area or from a person without permission, or maybe putting objects in their mouth that should not be eaten or not be put in the mouth to the tongue or up to the lips, so mouthing something. We want to find an appropriate replacement for that, asking to leave, asking for a drink or a snack if it's mouthing. And then we have some examples as well for that. Many times, problem behaviors functions get met, and that's why they continue. So ABA-based therapy really helps to teach our learners better ways for their functions to be met. And again, that really comes down to communication. How do I communicate what I need right now? And really teaching our kids how they can communicate with us or with others. Also in ABA, we create something called a behavior intervention plan, or a BIP. Oftentimes in schools, there are IEPs, which is an individualized education plan, but in ABA-based therapies, we do BIPs specifically for behavior. So that comes from a variety of different topics. We can get that from talking to client and caregivers. We do an intake process where we assess the child, and we do a parent meeting to kind of learn more about that child. Usually BIPs take a little bit to be created because we need to observe the child directly, and it takes a while to make sure that we are pinpointing the correct behaviors that need to be worked on. And it can take a little bit to find those functions and those triggers and what kind of sets that child off and things like that. So we do a lot of ABC data collection, again, antecedent behavior consequence. That's a direct assessment, but there's a variety of different ways that we kind of gather our information and gather our data before setting up a BIP. Individuals' interventions are really important. You may hear this called not just BIP, you may hear behavior support plan, behavior reduction plan, and it's not a one size fits all. So each BIP is specific just for that child. And that's really important because every child's needs are different. Every family's needs are different. And so we really want to look at one child and one family and say, okay, how can we help you most? How can we help you be the best version of yourself? And then that's how we create the individualized intervention. There's a variety of different components that are in a BIP. We always put in the dates of the plan that it started and the revisions, because we often have to update these as the child grows and learns. We always want to outline the behaviors that are for reduction, and then really important, those preventative strategies. How can we prevent this from happening? How can we really teach them ahead of time, before it happens, what to do more appropriately? Those antecedents or triggers, again, what might be upsetting to that child, what might happen before where they may engage in this, functions of behavior, and then again, the consequence. What's going to happen? Is it a reinforcement? Is it punishment? How do we increase or how do we decrease? And then most importantly, that replacement behavior. We have to have some sort of replacement behavior for those more inappropriate ones. We want to increase appropriate and decrease maladaptive. With ABA, our center uses 2 primary assessments, but we gather all of our programming and the skills that the child and the therapist are working on from specific assessments. Most ABA centers use specific assessments. We use one called the Verbal Behavior Milestone Assessment and Placement Program, better abbreviated as the VBMAP. And there are a variety of different skills and different targets that our kids work on. So maybe they are social skills, like they need to work on, communicating with other people or other children, or independent play. Are they playing appropriately? Manding, that's a common one. That's asking for your wants and needs. There's a variety of different ones, but it's really great that we're using an assessment, because it gives us an outline for skills on where we should start, what comes next, and then what our goal is at the very end of treatment. Another assessment we use is the Assessment of Functional Living Skills, and that's abbreviated as the AFLS. And this is more based around those daily living and self-help skills. So bathing themselves, dressing, toilet training, brushing their teeth, shopping, classroom routines, academics, things like that, more vocational and independent skills. And so that has hundreds of tasks that we can work on with kids from all ages. I think sometimes people think that functional living skills are more for older kids, but we want to start that at a really young age. Early intervention is so, so important. And teaching our children at a young age to change their clothes or go to the toilet by themselves is really, really important. And then lastly, we come to generalization. This is so important for ABA, because everything that we do here at a center or at another center or at a school, we want to translate that to home. If the behaviors are getting better here, but they're not getting better at home, we have a disconnect. We want to bridge that gap. The more that we can help our children generalize the skills that they're learning here to home, or to grandma's house, or to the uncle's house, or wherever they're going, is really going to help them be successful long-term and in the community. So generalization just means ensuring that our children can do these skills outside of the center in a variety of different environments. We want to make sure that they can identify items or objects no matter what they look like. All 3 of those pictures are dogs. They would all be appropriate to call them a dog, but if a child only knows a dog as just a golden retriever, they haven't generalized that skill to other things, as well as being able to describe things in different ways. That's not just a dog, it's also an animal, it's also a lab. Being able to generalize the skills and the knowledge that the children have is so important. And that's really our ultimate goal, is giving them that communication, changing their environment to be more socially significant, and really understanding what others are doing in the community and how they can be more appropriate in things that they're learning. We want our children of all ages, adults and young adults, everyone, to have the best, most appropriate skills. Sometimes our children accidentally learn other skills that get that same need that they have met, but we want to teach them some more appropriate ones. Really, that is a very quick synopsis of ABA. Applied behavior analysis is incredible, but there's a lot of information. So I know that was spurt out at you guys really, really quickly, but I hope that was really helpful for you all. I do want to open the chat to any questions that you guys may have. So let me switch this over. And if you guys aren't comfortable coming on screen and asking questions and you would like to put any questions in the comment section, I am absolutely open to that. I would love to answer any of your guys' questions. I'll give you guys a moment if you guys want to ask any questions to kind of put those in. And then I was going to also add, if you are a family member from Cornerstone Autism Center, if you want to just write your name in the comment section, that way I can kind of give credit to you guys for being here and let your BCBA know that you went through this training. That would be really great. Do we have any questions today?
I have a question.
Yeah.
So I'm getting ready to have my son evaluated at a different center.
Okay.
And I have a friend with autism who has 2 children with autism.
Okay.
And she is firmly against ABA therapy.
Yeah.
And a big reason is issues with consent and emotions being validated.
Absolutely.
So I kind of wanted to know how you guys go about those issues.
Yeah. So that, I will say, and I can't speak on this because I don't have autism, but I know that in the autism community, there are quite a few, especially individuals who have autism themselves, who are very against ABA. And unfortunately, there are centers that do not hold their ethical values where they should be. I wish that every center I felt comfortable with. To be honest, I don't. And that's why I work where I work, because I can ensure that those ethical guidelines are being followed. Autonomy and giving children, adolescents, adults, no matter what age they're a person, is so, so important. So something that we do here is, like I said, we often acknowledge, hey, it looks like you're upset. I'm going to go ahead and give you a break for a little bit, allow you to calm down and give you your own space. We're not going to immediately jump into forcing a child to do something or anything like that. We're going to give them that opportunity. And I don't know that other centers always do that. I can't speak for other centers just because I haven't worked at other centers. I've always worked at Cornerstone. But really talking about how that child may be feeling with them. We have a curriculum that we use often called Superflex, and that involves social thinking about what you may be feeling inside. And a lot of our kids have programs for speaking about what they're feeling about. I'm feeling sad. I'm feeling frustrated. I don't want to do this because this reason. And I think really providing children with that communication and honoring that is really, really important. So that's something that we do. We sometimes will do compromising, where sometimes there are tasks that, yes, we have obligations, we have to do this, but I understand that you're frustrated right now. Let's take a break, do something else, and let's come back to it, or let me help you with it. And kind of giving that child that power of them making a choice and them feeling comfortable with that situation. Does that kind of help answer a little bit? It's definitely a challenging process, and I think that when you are looking for an ABA center, really looking for some of those ethical things is really important, because you always want to make sure that your children are safe and you're really comfortable with everything. Something else that we do at Cornerstone, and again, I'm not sure if they do this at other centers, but we always put everything through to the parents before implementing. We're never going to implement something that the parents are not aware of. So any behavior plan is signed off by the parents first. Any sort of intervention that we're going to use is signed off on the parents first. So we communicate a lot with our families. If something's happening, we're going to call mom and dad and say, hey, this is going on. You know, this is my thought. What do you think about this? What are you comfortable with? So we really engage a lot with our families to ensure that they're a part of their child's treatment, because that's really important. Does that kind of help answer that a little bit?
Yes, thank you.
You're welcome. All right, let's see. We have another question. How can you become certified as an ABA therapist? So there's a variety of different ways. One, apply to an ABA center. What we do at my center is we have all of our new hires go through a 40-hour week-long training process. A certified ABA center or therapist is called an RBT, and it's a registered behavior technician. And that is outlined by the BACB, and they have specific protocols. So it has to be a training that's 40 hours long from a BCBA. It has to include passing a test, a competency assessment. Part of that is as a BCBA assessing that person. And then another part is they go to a testing site and actually take a test. We want to make sure that all of our staff are trained RBTs before they really are working on the floor. So they start that training process immediately. As soon as they're hired, we get a training class. They go through 40 hours of training, go through their test, so that we know that all of the staff that are working with our kids are certified, are qualified, and not just some random person we pulled off of the street. We want to make sure that our quality is there for our staff, and that helps make our families feel more important too. So to become certified, really you're going to need to you'll have to have a supervisor who is a BCBA. So the best part of that is to start by applying to an ABA center. Is a really great start. There are some online companies that provide trainings. I believe Relias is one of them. There's some different, Central Reach, I believe, does some online trainings as well. But again, that would just be the 40 hours. And then after that, you would have to have a BCBA supervisor who tests your competency and things like that. Good question. We are hiring. Any other questions that you guys can think of? Those are both really wonderful. Or anything that I can elaborate on. Maybe not a question, but you just want me to talk a little bit more about a topic that I went through really quickly. Can we get a copy of the PowerPoint? Absolutely. I'll make sure that I get the PowerPoint to Melissa, and she has all of your guys' emails, and we can absolutely make sure that you guys get a copy of the PowerPoint. Yes.
And I'll also send out, we will upload this recording to our YouTube channel, and I can send that out to you too. I can send it out to everybody.
Perfect. I'll give just a couple more minutes for any additional questions. And if you guys think of